for the price of a tank of gas here in the U.S., or a movie for a family of 4, you can greatly impact a Guatemalan family forever. I'm Seth Gary. I went with my wife and joined a team down to Guatemala, to the highlands of Guatemala. We taught on the water purification, sanitation practices, and dug latrines. Major problems they face are largely surrounding water, their purification of water, sanitation, and another one is smoke inhalation. We visited one of the huts there, and there was a newborn baby who was just a couple weeks old. And in their tradition, the mother and the baby stays inside the home on bed, not even walking around. Now, there's a fire that he had taken, rather from their cooking area in this small hut, to right next to the bed. The problem with this is that there's no venting. There's no chimney. It's just a very tight home, and it was filled with smoke. You could hardly see the other side of the room just because the smoke was so intense. We walked in, coming in from the outside, in just a few minutes, and our eyes are watering and our lungs burn. Well, that's the first few weeks, the first month of this child's life. Our primary objective was to dig these latrines. As we were leaving, there were still a few latrines that weren't finished. We were talking to the Guatemalan people there in Sequiba, and they promised that they weren't using any of these latrines until everybody had one. The amount of community that they had was so humbling.
With the help of volunteers like Seth Gary, and with your support, Medical Teams International is transforming the health and lives of 22 communities in Guatemala. In the coming year, we will be installing ventilated cook stoves, building latrines, providing access to vaccines, medical care, and clean water. At Medical Teams International, we believe that children should not be dying from preventable diseases. And every child, mother, and family should have what they need to lead a healthy life.